I'm Dr. Allie with Neighborhood Chiropractic and Acupuncture in Southeast Portland, Oregon. And today I'm going to review how we assess and diagnose tendon injuries in our office. The goal of the assessment is to determine what structure is causing the pain. So in the case of a tendinopathy or tendon injury, we want to determine that the tendon is in fact the cause of the pain and rule out any other structures such as a strain of the muscle or any injury to the joint or a nerve in the surrounding area. Assessments start with a history where we ask questions and then move into the physical examination. A history is a series of questions where your provider will ask you what caused your pain, maybe what happened that started it, if there were any habits that changed recently, and then what the pain feels like, sharp, dull, any other quality that might describe your pain, and then anything that makes the pain worse and anything that might make the pain better, and then if you've done anything to help address the pain so far. After the history, which gives the provider a little bit of an idea of what might be causing the pain and how they want to do their exam, we move into the start of the exam with passive range of motion, where the provider will move the joint for you, which helps assess the ligament and joint structures to see if they're contributing to the pain as well. Then we move into active range of motion, where your provider will ask you to move that joint yourself to assess the muscles and tendons in the area to see what is causing the pain. Then we can move into palpation, where we use touch and pressure to assess what structures are tender and how tender they are. Then we can go into muscle testing, where we're going to assess the strength of the muscles and then whether or not they're causing pain, and make sure we have an idea of all of the muscles and musculotendinous areas that could be contributing to the pain. Then we can move into orthopedic tests to help assess other areas and rule out other potential issues that could be mimicking the same type of pain. This could be addressing the joint, various other structures, the bursa, and the superficial nerves. Once we have an understanding that the tendon is the cause of the pain, then we can move into the in-office treatment, which we will go over in the next video, so stay tuned.